Have you ever considered having Wharton's jelly treatment for a beat up joint, muscle, tendon, etc.? What is Wharton's jelly? Why would it work for you? What are stem cell type treatments in general? This video is going to give you the top handful of tips and hints, things that I've encountered in my career so far doing this the last 6-7 years. So what we're using here is we're using Wharton's jelly from a company called Regenerative Labs. They've had great stable products for my patients. I've been using them for years now. I've even injected their products into my own knee a couple of times with amazing results. Back to running when I couldn't even walk 100 yards before the injections. So what is awesome though with their Wharton's jelly, aka cryotext, is you get this kind of threefold improvement that can happen. They've run a lot of studies. They've been trying to prove to our government, CMS, Medicare, that these products do a great job of healing. So they have years of data behind it. They were one of the first in the game in America doing stem cell treatments. So what happens is you get this initial healing phase. Many arthritic joints or many injured tendons almost look raw, almost even sometimes bleeding when you're looking at them like through an arthroscopic camera, almost as if you scuffed your knee. So you end up getting this initial healing where it goes and kind of heals and scabs over that wound, and people can get kind of an early pain relief in the first week or two. That's not really tissue regeneration in that window, but they're feeling better, which is awesome. Second level, and they've got a lot of data on electron microscope on this, there are tissues that come in called fibroblasts and they build a scaffolding. And so they've actually compared Wharton's jelly to standard PRP. Both will build a scaffolding, but the scaffolding with PRP is just a few little scaffolds coming together. The webbing that happens with Wharton's jelly is amazing. There are so many more lines coming together between the injured tissue that you really can't quite see through to the bottom of it. It's like a really dense spider webbing that happens. The third layer then is the stem cell effect. And so stem cells wake up, migrate into that area. They see inflammation, they see healing and repair, they see the scaffolding, and they begin to attach to it and fill in whatever is injured. So we've got patients who've had cartilage injuries where we've got before and after MRI, and you see the cartilage regrowing in those areas. Same with tendons. I've had patients who've had tendon tears that have been going on for 10 years, and they're not big enough to be surgically repaired, or they've been kind of too far gone for too long. We inject them and we do an MRI a year later and the tendon's all healed up. It's awesome stuff. We use it a lot for tennis elbow, especially that heals really quick if you are a mechanic or if you're someone who's playing a lot of golf, you get golfer's elbow, etc. But then on top of that, we use it a lot for knees, for hips, for shoulders, for hands. And in this case, today, we're gonna be using it in some injured muscles in a young lady's back that have been chronically injured. We've got ultrasound showing where the injury is, and we're narrowing that down and going to be treating those areas because nothing else has worked across years. So let's see if we can get this to work for us. So typically we see healing kind of depends on the injury, where it is, what's going on, which makes sense, of course. But in general, I say you're going to get the most of your healing at around 6 months. So typically people will feel some improvements in the first few weeks, which is really encouraging. Some will even feel it at a month or 2 months in. 3 months is a pretty good step forward. Like, wow, I can move nicely again. I might even start jogging a little bit if it's a knee injection, for example. If it's a tennis elbow, people will feel it even quicker sometimes because that's not a complete tear. But usually that solidification, that strengthening in the cartilage, that more mature cartilage we're looking for a beat up joint, we tend to see that really maximize around 6 months. With my knee injections, I feel improvement between 3 and 6 months, but it's amazing the difference. I might jog with a little bit of sensitivity, and then at the 6-month marker, I'm jogging and I don't even think about my knee during a 2 to 3 mile run. And just for reference, I've done 2 injections across 5 years, so it's not like you need to do these all the time with this, where other stem cell products or treatments tend to seem to need to be done yearly, and people feel it wearing off. Most of my patients have not needed to be re-injected within a year. It's usually 2-3 years later we're talking about it. So you've got a treatment that's affordable. It's still expensive, but it's not as expensive as others, and yet it can last you more than a year, usually pretty reliably, which is really fun. I've been doing stem cell type treatments since 2018-ish, 2019, and so you name the recovery plan, I've seen it. I've seen recovery plans from you should be on crutches for 8 weeks before you even put weight on this joint to hey, I just injected you, I want you to do a marathon tomorrow, and everything in between. Usually what I recommend is kind of, if it hurts, don't do it. We don't want to damage the infantile tissue that's being grown by crushing it right away with whatever's been hurting you. We want to give that time to grow and solidify. So I usually recommend a 2 to 4 weeks of taking it easy. So if it's a knee, that kind of means you have to just be gentle with it. In this case, if it's a movement, like when I do this, it hurts. Okay, let's try to avoid that for a couple of weeks and then test the waters with some gentle stretching and see how that plays out. So it depends on the person, what we're injecting, but I usually don't recommend this very strict, long drawn out situation. I've literally had mechanics where I've had to inject their tennis elbow and they can't take a day off. They're back to pulling on wrenches the next day and they have healed just fine. So that mindset of just get after it, there might be some truth to that. I did have one guy though that I injected his knees and he went back to, he's a bodybuilder, he went back to very heavy squatting within 2 weeks. It was something like 300 pounds. He's like, I normally do 400. I knocked it down to 300. And his knee blew up like a basketball. We got it to calm down. He ended up still having a good result at the end, but he definitely went backward before he went forward. So I recommend 2 to 4 weeks, just kind of taking it easy and testing the water slowly. So a lot of people, when they talk about stem cell treatment or Wharton's jelly, where are you getting these from, right? They're not my patient's umbilical cords. They're someone else's, right? And so the first question that comes up with that is, are these aborted tissues in any way? The number one reason why I connected with the company I use now, Regenerative Labs, is they have been very forthright. If you look them up on the internet, they have all over disclaimers all over their website. These are not aborted fetuses. These are patients who have gone through an entire pregnancy. They've been tested before the delivery, and then the delivery actually has to be at a C-section. They treat it as if it was an organ transplant situation. They're in there with the igloo cooler with the dry ice, and the second baby is done with that umbilical cord, they take it and they drop it in there and they move on to process it. So it can't even be a vaginal delivery because there's variables that you can't predict with those. It has to be a C-section. Other companies I've worked with in the past, I had to dig to get that answer. It's not legal in the United States to use aborted tissues, but some of them it took a lot of arguing. Regenerative Labs even was like, hey, do you want me to do a Zoom tour with you and show you behind the scenes how it works? Very good upfront company. Been using them for quite some time now with great results. Follow-up to that is, the second question is, people say, it's not my tissue. Am I gonna get a graft versus host reaction? Like if I had a kidney transplant, I'd have to take medicines to keep that from happening. What about for me? Here, it's not my tissue. The big thing with graft versus host type reactions is all about blood. If there is blood being transferred with that, blood vessels, etc., people are more likely to have a reaction. Obviously, the larger the organ, the more likely that's going to happen. In this situation, the Wharton's jelly has been cleaned. There are 0 blood products. In fact, there are even some religions that refuse to allow other blood products from other people into their bodies, and they are actually okay with these kinds of injections. That shows you how blood-free they are. So general data on Wharton's jelly, it's very, very rare to see a potential reaction. I have never had one here in this clinic in the last, what's it been now, 6-7 years. And we do these injections pretty regularly. The most famous or most common type of transfer we see is actually a lens replacement for cataracts. That is by far the most transplanted tissue in the United States by a large margin, and the amount of reactions with that are so minimal. It's not even a percentage that's easy to actually identify. That's how rare it is, once again, because there's no blood product.